Hello, I'm presenting an application to track and score patients' social determinant health risks. This application will be developed by Team GT MKSM, which consists of the individuals listed at the bottom of this slide. First and foremost, what are social determinants of health? These are exposures to risks other than physical and genealogical. They tend to be social strata, lack of education, lack of resources, impoverishment. Much of the information in this presentation was borrowed from the cdc.gov's site on social detriments and programs to deal with social determinants of health. Examples of social determinants of health include availability of resources, access to education, public safety, transportation options, residential segregation, language and literacy. A rule of thumb is if you are thinking of a marginalized population in our society, they have high risks based on their social determinants. Why are social determinants of health important? Poor health outcomes are often a result of the interaction between individuals in their social and physical environment. This is the low-hanging fruit of improving the health of the population at large. If we can improve the environments in which people live and lower their exposure to certain risks that we can easily control, then we can improve health outcomes for the population at whole. Think of it as raising the floor on the highest risk individuals for incurring medical claims. The population at large's interest is improved by bending the healthcare cost curve, which is a term that we heard around 2010 when there was debate over the Affordable Care Act. There are many resources, both publicly and privately funded, that exist to aid in improving the health of at-risk individuals. Planned Parenthood tends to sponsor programs that control unwanted pregnancy. 12-step support programs often deal with physical trauma and addiction. Job placement programs can improve somebody's socioeconomic standing. Smoking abatement programs and such tend to lessen exposure to addictive substances that degrade health. Other programs exist that are often either completely free or at low cost to the individuals participating in them. The shortcomings of current approaches to matching individuals to resources, it's expensive. These programs need to track participants not just in the short term, but over a period of years. That's often expensive. The populations in question that are high risk are often transient by nature. The use of self-assessment is often unreliable because the populations we're talking about either have language limitations or lack of education. Quote from Peter Drucker: "If you can't measure it, you can't improve it." If we wish to improve social determinants of health, then we need to nail down exactly what we're measuring and how to measure it. How can technology help match individuals to resources? Our intention is to design a healthcare provider-facing application that can present a visually meaningful score assessing risk and longitudinally tracking and measuring those patients that are identified as high risk or at risk. This is a Gantt chart showing our intended development of the application over the course of this semester. Finally, the business case for developing this application. This benefits society as a whole. This benefits hospital networks. This benefits insurance providers, and it benefits the patients, and it benefits the healthcare providers. The reason being that if we can raise the floor and lower the costs incurred by those individuals in our population that are identified as high risk, then we are lowering the costs absorbed by the population at large in emergency rooms and local communities. I thank you very much for your time, and I hope you have a good day.